Welcome to Professional Certifications channel. In this video, we're going to break down one of the most essential areas in the CPC exam and in everyday medical coding, evaluation and management, or E/M coding. Let's simplify it together so you feel confident when you see E/M questions on your exam.
What is evaluation and management E/M? E/M codes are used to report services provided by physicians and other qualified healthcare professionals when evaluating and managing patient health. This includes things like office visits, hospital visits, consultations, ER visits, home care visits, preventive exams. CPT Code Range 99202 to 99499.
Key components of E/M services. As of 2021, for outpatient and office visits, E/M coding is primarily based on 1. Medical decision-making, MDM. Number and complexity of problems addressed. Amount/complexity of data reviewed. Risk of complications or patient management. Or 2. Time spent. Total time on the day of the encounter. Includes reviewing records, counseling, and coordination of care. You use either MDM or time, whichever supports a higher level of service.
Categories of E/M codes. Office or other outpatient services. CPT 99202 to 99215. Common in physician practices. Hospital inpatient services. CPT 99221 to 99239. Includes admission, subsequent visits, discharge. Emergency department services. CPT 99281 to 99285. No distinction between new or established patient. Consultations. CPT 99242 to 99255. Used when one provider asks another for advice. Nursing facility services. CPT 99304 to 99318. Includes admission and routine care in nursing homes. Home or residence services. CPT 99341 to 99350. House calls, assisted living. Preventive services. CPT 99381 to 99397. Well visits by age group and new/established status.
CPT examples. 99214, established patient, moderate level MDM, 30 to 39 minutes. 99223, hospital admission, high-level MDM. 99285, ER visit, high complexity.
E/M coding tips for the CPC exam. Always read the documentation thoroughly. You need to identify whether the provider is using time or MDM as the basis for code selection. Understand what constitutes complexity. For MDM, know the difference between low, moderate, and high complexity. New versus established patient. New, no face-to-face service in 3 years. Established, seen in last 3 years. Time matters but only when documented. Make sure the provider's note mentions total time clearly if time-based coding is used. For preventive visits, remember they include counseling, screenings, and age-appropriate exams.
Common documentation errors to avoid. Missing total time. Incomplete MDM breakdown. No chief complaint listed. Choosing a higher level without justification.
Evaluation and management coding is one of the most heavily tested areas on the CPC exam, and it's a major part of real-world coding as well. Make sure you study the E/M guidelines, know how to use MDM tables, and understand time-based coding.